The chairman of the Presidential Steering Committee and Secretary to the Government of the Federation, honorable ministers here present, Deputy Ambassador of the United States, Head of Mission, colleagues, country representatives, distinguished ladies and gentlemen, permit me to rest on already established protocol. Permit me to start by once again expressing our profound appreciation to all Nigerians and indeed friends of Nigeria for the support we received during the first phase of our strategic COVID-19 vaccination rollout, which officially ended a few weeks ago. As you are already aware, yesterday we received 4,080,000 doses of Moderna COVID-19 vaccine from the United States government, donated through the COVAX facility. Before the arrival of these vaccines, the federal government had proactively procured 60 units of ultra-cold chain equipment, out of which 37 have already been deployed to the 36 states and the Federal Capital Territory. We have experimented and verified our ultra-cold chain facilities are capable of storing COVID-19 vaccines that require temperatures of below -40 degrees Celsius to -80 degrees Celsius. The vaccines will be deployed to the states as soon as we receive clearance from NAFDAC. This is in line with standard practice. When the vaccines arrived in the early hours of Sunday, NAFDAC officials were on ground and they randomly collected some of the samples for testing to certify if they are fit for use in Nigeria. Once we receive NAFDAC clearance, which should be in a couple days, we will commence distribution to the states that are already on standby. Like the Oxford AstraZeneca vaccine, the Moderna vaccine requires 2 doses, which should be taken at 4 weeks interval. We strongly advise Nigerians who are eligible for vaccination to come out and get vaccinated and ensure that they follow the vaccination schedule in taking their second doses when they are due. The Moderna vaccine has been proven to be effective in preventing severe form of COVID-19 after the second dose. It is also, from some studies, 74 to 94% effective against the Delta variant of COVID-19 virus. While Moderna and AstraZeneca vaccine do the same job of preventing severe COVID-19 and death, we advise that people should avoid taking the vaccines one after the other. In other words, those who have taken AstraZeneca as first dose should also take AstraZeneca as the second dose. And those who will take Moderna as the first dose should take Moderna as second dose when due. We're engaging with the World Health Organization and the SAGE to look at the new recommendations around AstraZeneca and Pfizer vaccination. On this note, it is important to inform you that the next batch of AstraZeneca vaccines will be arriving within the next couple of weeks and will be dedicated to second dose administration. This is to ensure that those who have taken their first dose are provided with the same vaccine for their second doses. To improve utilization and minimize challenges in our electronic management of information data, the EMID platform, we have developed a mobile app that can be downloaded by anyone from the Android or Apple store. The app contains verification auto site, which enables clients to verify their records within 24 hours, and an effective troubleshooting platform. With this app, clients can register and receive SMS and email confirmation efficiently. We plan to launch this on Thursday this week. We had previously informed you that we'll be adopting the whole of family approach to integrate COVID-19 vaccination with other basic primary healthcare services, such as childhood vaccination, screening for hypertension, and other non-communicable diseases. This will ensure that while protecting eligible Nigerians against COVID-19, we are also concerned about the total health of the individual and the entire family. This will further enhance the acceptability of COVID-19 vaccines because we're taking into consideration that it is not only COVID-19 that is a health challenge in Nigeria, so we're using the platform and the focus on COVID-19 to also address other health issues within the community. Like I mentioned in our earlier briefings, we have assurances of the delivery of 698,880 doses of the AstraZeneca vaccine within the next 2 weeks, and also 3,924,000 doses of the Oxford AstraZeneca vaccine later this month. This will again go towards vaccinating those who have not had their second doses and then give an opportunity for others to take their first and second doses. We recognize the fact that Nigeria could not have been successful in fully utilizing the 4 million doses of AstraZeneca vaccines we received from the COVAX facility in the first phase without the support of the media. As we continue to appreciate this, let us be mindful that the current phase of the vaccination, the second phase, would require increased delivery of responsibility and commitment from the media. We need to double our efforts in confronting misinformation, disinformation, and educating Nigerians on the need to get vaccinated against COVID-19. We are aware that some concerns may be raised around which of the vaccine brand is best and who is eligible to take which. Let me be clear that all the vaccines we receive in Nigeria are safe and effective in providing protection against COVID-19, inclusive of the Delta variant. No vaccine is superior to the other. They only have different manufacturers, but all of them will deliver protection against COVID-19 to anyone who is vaccinated, especially severe forms of COVID-19. Anyone who is 18 years and above and has not been vaccinated is eligible to take any of the vaccines in the recommended doses. On this note, I would like to call on all eligible persons in the country to register and go to the nearest designated health facility for vaccination against COVID-19. The government is committed to providing safe and effective COVID-19 vaccination and ensuring that all eligible persons in Nigeria are vaccinated. Let me remind us that the detection of the Delta variant of COVID-19 virus in Nigeria underscores the need to continue to observe non-pharmaceutical preventive measures such as wearing of face masks, social distancing, and hand hygiene to curb the transmission of the disease. We cannot overemphasize the use of these public health measures. In conclusion, I would like to thank the state and local governments, our partners, our donors, traditional and religious leaders, and all our dedicated frontline health workers who made it possible for us to fully utilize the vaccines in the first phase and all the preparations that have gone into rolling out the second phase of the vaccination. I thank you for listening.
Profound gratitude to the U.S. government for this very generous and very helpful donation to the country. So thank you very, very much indeed for that. Now, there are two categories. We had some issues with diplomats at ports of entry, and it was really important. The Presidential Standing Committee decided that we had to come up with something that was clear, that everybody could understand, all the diplomats, and not have the difficult situation that we were having. So basically, there are two categories of countries, as you know. They're the restricted countries, 4 countries that are under a restricted protocol, and other countries. Now, regarding diplomats coming from the restricted countries or that have visited or passed through those restricted countries in the last 14 days. There's a special protocol that we have in place. Now, so of course everybody has to do a PCR test, before traveling 72 hours before. But for non-restricted countries, the diplomats coming from those countries just have to have that 72 hours prior PCR test, and then within 7 days do a test in any accredited private laboratory. If they have no PCR test taken, a valid PCR test, then they would have to be quarantined in government facilities. But if they do have a PCR test, they still have to do a 7-day self-isolation at their residence. And, if they do test positive for diplomats and it's a mild condition, they can isolate at home. And if it's moderate to severe, then they have to be in accredited hospital facilities. Now, for those diplomats coming from non-restricted countries, they can get special waivers from the 7-day isolation. And this will be applicable or available to high-profile diplomats. And so if, for instance, they're coming to meet with the president or the vice president, then they would be they'll qualify for a 7-day isolation. Then the others would now be decided on an ad hoc basis as to whether they would benefit from that waiver. So that's in respect of diplomats coming from non-restricted countries. Now, diplomats coming from non-restricted countries, then diplomats coming from any of those four restricted countries or have visited any of those four restricted countries within the last 14 days, there's a possibility of a waiver for them to very essential personnel on special recommendation, Ministry of Foreign Affairs. But nevertheless, with that waiver, they would still need to be screened at the airport, before entering into the country. And those waivers can only be given by the Presidential Steering Committee. Sorry, I had said Standing Committee before. Presidential Steering Committee can only issue the waivers that will be shown at the ports of entry. And now, this is a catch, and this is what has caused a little bit of some issues in the past. Now, all diplomats coming from any of those four countries within the last 14 days have to, we're afraid, quarantine in approved government facilities. And the only exemption or waiver from this would be for the ambassador of a particular country and his or her spouse and the deputy ambassador, but alone. So only those three categories of diplomats can get an exemption not to isolate. They'll still have to isolate in their private residence or whatever, but not have to isolate in government-approved facilities. And in those cases, they have to do tests on the 2nd day after arrival, and also 7 days on the 7th day after arrival. But we did a briefing for all the diplomats and went through in greater detail, to make it absolutely clear. And we've just finalized the text, the regulations, and we will be making that, circulating that to all the missions and also to our missions around the world to share with their host governments. So that's the situation. Thank you very much.
Lagos has more than half of all these cases. And the specific number, well, that is a matter of detail. And as far as the question of whether we are officially in the third wave, it's not something that starts at once. It starts gradually. It is insidious. So we're beginning to see an increase in the number of cases that we used to see. We are doing about 500 cases now, whereas it used to be much less than that. So we are obviously looking at other countries around us. We see that it started in East Africa, in Kenya, Uganda, South Africa, and then and Congo, then began to appear in West Africa, in Ghana, Senegal, and now it's beginning to enter Liberia and Gambia and so on. So all of us are seeing gradual increases. The Director General of the West African Health Organization was with us this morning. We also confirmed that it is entering the region. So you cannot give it an exact start date, and by the time you start doing sequencing, more genomic sequencing, to identify the exact sequence of the virus, you will be not very sure whether it's Delta, but it looks as it's going to be, because the virus has been identified in at least 13 cases here. But we have not yet sequenced enough or received the results of enough sequencing to be quite sure that, yes, the Delta virus is responsible for all this increase. For example, somebody raised the question whether, okay, is this increase we are seeing not connected to some activities I had recently, some public activities around holidays, and there was a cleric that had a funeral for a cleric. Are they connected? These are all scientific ways of asking questions and seeing how this one really connects. But evidence looks like it is the third wave because it's regional, and then what we haven't got enough sequences yet to be 100% sure. But clinically, we are still okay. We are not seeing more and more people losing their lives yet. We are not seeing more people getting more sick. The bed occupancy is not skyrocketing, although in some areas there are more admissions. In Lagos, for example, but on the average, it's not out of our power. The health system is still very strong and still able to cope with what we are seeing. What we are doing here is to make sure we take more preventive measures. If we're able to prevent more people from being sick, if we're able to hold this virus at a particular level, then our health system will not be threatened. In that case, we will have overcome the Delta variant more easily than other countries. Because right now, it is not so much how strong your health system is, but how well your system can cope with the attack of the virus. And if you can cope well, you are fine. But generally, you continue to strengthen your health system. We are having more oxygen, about 70 or more oxygen plants coming up, improving more ventilators. We are training more people. We are training people for intensive care. We are training people in surveillance, in sample collection. We are looking at our strategies to improve everything so that we are more prepared. We also do a lot of examination of, testing of visitors to reduce importation. We are doing land border testing. We are doing testing even at seaports. We have found 5 cases among seafarers in the Delta region. We have found even at the land border, we found at least 3 cases. So we're checking everywhere to reduce importation and also to reduce transmission so that the problems arising from all of these will be less for the health system. So that's the general approach we take.
The impact of increasing numbers of the Delta variant that we're finding, and whether there's any impact on the effectiveness of vaccines. When we talk about effectiveness of vaccines, we always have to think effectiveness against what? What are we trying to prevent? So the most important thing we're trying to prevent are severe illness and ultimately death. And as much as we are dialoguing here about events in Nigeria, really, these issues are bothering everyone across the world. And what is going on now is a very effective coordination of research happening every day with sister national public health institutes across the world. And so far, right now, there have been a few studies that have shown that even with the Delta variant, the vaccine is very effective in preventing severe cases, hospitalizations, and deaths, right? Which is ultimately what we want to achieve. There's been some new data over the last week that transmission might still happen, even if you're vaccinated. But to be honest, it's a theoretical construct because, yes, transmission could lead to more cases and ultimately more deaths, but in itself, in that individual patient, if you're vaccinated and you still get the infected, you will not, you're much less likely to have a severe illness. So as much as we're working very hard within the country to prevent cases, the key thing is to also do the diplomacy and the work the federal government is doing to get more vaccines into the country and to then make sure Nigerians take as much of the vaccine as possible. So the message is still, despite the Delta variant, please do get vaccinated. The vaccine prevents severe illness and prevents deaths in everyone that has been vaccinated. Your second question was on sequencing in Lagos. So let me just try and be as precise as possible. Right now, we found, as of this morning, 32 confirmed cases of the Delta variant in Nigeria, 32, right, from 5 states: Abuja, Oyo, Cross River, Lagos, and Akwa Ibom. Some of these have been in returning travelers, some have been local transmissions. Now, the biggest batch of sequencing that we got this morning was out of Akwa Ibom. So out of 23 cases there, 19 were the Delta variant. And that's why I said 80% of the cases in Akwa Ibom today sequencing is a very complex activity, turned out to be Delta. So that is likely, that is the most likely cause of the increased transmission we're seeing suddenly out of Akwa Ibom. Akwa Ibom was not one of the hotspots in the first and second waves, remember. We had FCT, Kaduna, Lagos. So this is really a new state, so a lot of attention. So most likely, somehow someone returned to Akwa Ibom with a Delta strain, started transmission activities, and given the increased transmissibility of this variant, we're now seeing quite a number of cases happening. So we're intensifying action in Akwa Ibom to contain it. Lagos, yes, we haven't sequenced as many cases as we would like to. We have 3 facilities in the public sector in Nigeria with sequencing capacity: NIMA, NCDC, and the Africa Center for Excellence in Genomics in Ede. In addition, there are a few private sector players that now have that capacity: 54Gene, a private sector lab in Lagos. So we are working with Lagos to identify the most appropriate facility for them to sequence their samples, and I'm sure that in the next few days, we'll really scale the sequencing coming through out of Lagos so that we fully understand what is happening in Lagos. Like our chair said, right now, over 50% of all the positive cases in Nigeria are still reported out of Lagos State. At some point, it was even as high as 70%. So understanding what is happening in Lagos is critical to understanding what is happening in the country. And your final question on, or the final question on the third wave, you know, there's no scientific definition of when the third wave starts or stops. But we are seeing an increase in cases, and if you look at the epidemic curve, you see clearly an increase in cases in the last few weeks. But remember, Nigeria is a big country, right? That we're having a third wave nationally. You need to look at the data at a slightly more differentiated level. Like I just said, many of the cases are being reported out of Lagos, Akwa Ibom, Oyo, Rivers. And many states, especially right now in northern Nigeria, are really not seeing a lot of cases. So it's still a very different picture across the different states in Nigeria. And that's our work, to continue to do our surveillance and advise our colleagues on how to respond. Thank you. Sir.
Samples taken abroad.
To the best of my knowledge, we're not taking samples outside of Nigeria for sequencing. There were, earlier in the outbreak, a few samples done by universities in Nigeria in collaboration with their partner institutes. But like I said, right now we have 3 public sector institutions with sequencing capacity and 1 private sector institution. And our advice to every state in Nigeria is to use these public sector facilities for all the sequencing work we're carrying out. And we're very grateful. The reagents, the equipment, the human resources required for sequencing is very complex. This is not something you just plug and play. So we're working to beef up that capacity and make sure that we are able to deliver the information for our country. So right now, we're not sending any samples outside of the country for sequencing.
What types of assessments will be done with the samples of the vaccines. So what NAFDAC will be doing with these sampled vaccines will be really to do some of the basic tests around the appearance of the vaccine, looking at the pH, the osmolality. Like you say, these are things that you're very familiar with. They'll be doing some very basic tests. Most of the more complex assessments have already been done, right? And I'm sure that you've heard in the past during our media briefings that what regulatory authorities do is use what they call the reliance mechanism, right? When stringent regulatory authorities such as the FDA and other regulatory agencies have already done some of the assessments, then NAFDAC uses the data that they have produced to also take some decisions around the quality, for example, of the clinical trials that have been done. And then when the vaccines are brought, there are standard procedures that NAFDAC does just to validate that all of the information that is provided for in the certificate of analysis, for example, aligns with what is expected for the vaccine. This is exactly what was done with the Oxford AstraZeneca, so it's not any different with what is being done with the Moderna. And it is only when NAFDAC is satisfied that the green light will be provided for us to now start rolling out the vaccines to the subnational level. This is what happens for all vaccines. Then there was a question about the issue of electricity and the challenges with maintaining the potency of the vaccine, given the epileptic electricity supply in Nigeria. So it is not new to the Federal Ministry of Health and the National Primary Healthcare Development Agency, the whole concept of keeping vaccines at temperatures that will keep them potent. These are investments that the federal government and our partners have done in the last few years, especially with the polio eradication program, right? So we've been able to procure a lot of cold chain equipment. But in terms of ensuring that there's electricity all across the states, the guidance has always been that these cold stores where vaccines are kept, this cold chain equipment where vaccines are kept, are usually hooked up to what they call the blue line, like dedicated lines that have constant electricity. But apart from that, what we've also told the states to do, particularly because of the sensitive nature of this vaccine, is that the ultra-cold chain equipment will be linked up where there's constant, uninterrupted power supply. If they are not satisfied with the level of electricity, the constancy of electricity in their cold stores, the backup generators that they have in their cold stores, they can also move this cold chain equipment to maybe the government house where maybe electricity is more constant. For some of the states, they've identified tertiary hospitals where electricity is more constant and there's regularity of backup power from generators that are fueled constantly. So these engagements have been happening in the last few weeks. So we are not concerned about whether states will be able to maintain these temperatures. At the subnational level, so the unique nature of the Moderna vaccine is, although it requires ultra cold chain equipment when it's being transported from the United States to Nigeria and then storage at the national level, it has the capacity to remain potent for up to 30 days within a temperature of +2 to +8 degrees Celsius. So at the subnational level, the LGAs at the health facility level, we're going to be deploying the vaccines there, and the health workers are being trained to know that they can only keep these vaccines for up to 30 days. So from our experience of the first phase, we know that they are able to finish up these vaccines within a week, and then they come back to the LGA level or the state level to get additional vaccines. In terms of the question from Vision FM was, he's of the opinion that those who haven't taken the vaccines are those that do not want the vaccine. There's nothing that is further from the truth. I mean, we came to Nigeria with just about 4 million doses. That's a far cry from what we need, right? And we know that right after we finished the first phase of the vaccinations, our phones were being, blasted with calls about we need additional vaccines. Here's the third wave coming. Where can we get vaccines? We got a lot of calls from the state. So on the one hand, we acknowledge the presence of vaccine hesitancy, but anybody who has not taken the vaccine so far is not necessarily vaccine hesitant. The vaccine has just not been available. Nevertheless, we're working with the Ministry of Information, NOA, our partners, NGOs, traditional and religious institutions. We're using the same templates that helped us eradicate the wild polio virus to really send out information out there. In the next few days, the Honorable Minister of Health will be unveiling a new strategy that goes all the way to the world level, where we're going to be focusing on really working with all of the partners at the world level, the LGA level, to make sure that the messaging goes straight to the communities, using community-based resource persons, right? The biggest challenge that we face right now with the vaccination is making sure that we get the correct information to Nigerians, especially in the face of misinformation and disinformation. And we believe that because Nigerians, for the most part, are rational, if you give them the correct information and they have these kinds of information coming from people that they trust, Nigerians will get over that hump of hesitancy. So on the one hand, yes, hesitancy exists, but we believe that we will overcome that, just as we have overcome hesitancy that we saw during the polio eradication drive. But we cannot do this alone. This is why we need the media to continue to point out and call out fake news, disinformation and misinformation about the vaccines, and provide the correct information about the vaccine. This is why we are partners. This is why we continue to look up to you to continue to do the outstanding work that you've already been doing in the last few months. Finally, in terms of our communication, we recognize that there's a lot of work that needs to be done. This is why we are very happy to get the backing of CACOVID towards providing support for communication and social mobilization activities. So thank you very much for those questions. Very much, Rachel, for that question. I like the fact that you do your research before you ask the questions, but it's also very important that you take the opportunity of this platform to get clarification. So the 12 hours, right, within which the vaccine should be used, right, is after the vaccine has been constituted, right? After you open the vaccine and you start using it, you have to use it within 12 hours. So no matter how remote the health facility is, once the vaccine is opened, it needs to be used up within 12 hours. Even if the health facility is here within Abuja, you still need to use that vaccine within 12 hours. So for somebody who is in some distant rural area in Taraba or Adamawa or wherever it is, the health worker is trained not to open the vaccines, right, until they are sure that they have the numbers of clients to use. So if, for example, they are giving 100 vials of vaccines, right? They're not going to open up all those vaccines, right? They're going to wait, knowing very well that those vaccines can be stored in regular refrigerators for 30 days, right? So no matter how remote it is, you have the window of 30 days to take it to that remote setting and then bring it back when you're not going to use them. Yes, thank you. I think you need to verify your information. It doesn't make any sense, and I do not believe that the UK government will put people's lives at risk. I think we should verify that information. Quarantine, that is their rule, and we have to go with that rule, because those rules are provided even ahead of your travel to that country, right? Just like people also complain about maybe the rules that we have in Nigeria. We need to protect Nigerians just like UK citizens need to be protected by their government, but they will not be given additional vaccines when they have proof that they've been already vaccinated. Thank you.
Thank you very much, sir.
Questions have been dealt with most appropriately. Mitari, the quarantine protocols for every country is different. What we have in Nigeria is different from what they have in the UK. So the demand, right now, if you are traveling from the United States and you are fully vaccinated into the UK, you don't need to be quarantined. They've given them that exemption. So there are differences in terms of protocols. So I think probably what was conflicting your mind was the fact that after the vaccination, we're being asked to quarantine. If you come in from the UK into Nigeria, you will be demanded to quarantine for 7 days. Isolate, not mandatory quarantine, to isolate for 7 days until you go through the processes of the tests, the 7 tests that would allow you to exit. NAFDAC test, it's been adequately dealt with, but let me emphasize the fact that NAFDAC has a responsibility to even test the batches of vaccines that come in. So far, we have had about 4 million Oxford AstraZeneca applied, or Nigerians have been vaccinated with that. The next batch that is coming, NAFDAC has a responsibility, because it's a different batch from the one that has been used, to test it before it is applied. So there are regulatory tests. There's nothing strange about it. They will go through that process. Once they are satisfied, we would allow the vaccination process to start. Samples taken abroad. Okay, Chukwe has dealt with that effectively. Omar Liberty, you did allude to the fact that the Delta variant is in country, and that whether we are contemplating some measures, nothing is off the table. Let me be very categorical. Nothing is off the table when it comes to protecting the lives of the people of this country. We would not hesitate in taking measures that will be considered quite stringent. All the countries of the world are applying different measures. Countries that were adjudged to have successfully dealt with COVID-19 suddenly realized that they had to impose some certain measures to ensure that they continue to balance lives and livelihood. And we will not hesitate. Like I said, nothing is off the table. We will continue to study the situation. We've always been guided by science and facts and the experiences of other jurisdictions before we take informed decisions. And we will continue to do that, because it is very, very important that COVID-19, the virus is novel. We will continue to understand the way it operates, its mutation, epidemiology, and all manners of things. Everybody is on a learning curve. Nobody has the full story. And until we get to such a situation where we are comfortable about the variants in country, it's not only the Delta variant that is in country. There are other variants. Chikwe didn't address that, but probably at an appropriate moment he will talk about that. So we're dealing with different variants, and we will not hesitate to impose any kind of processes or protocols that will help protect the people of this country. So far, so good. We've tried as much as possible, in spite of the weaknesses in our health infrastructure, with the support of the friends of Nigeria, donor partners, and the resilience of our people being able to get to where we are. I believe we'll continue to do that. And like I said, nothing is off the table. When it comes to containing this virus, we will do everything to ensure that we contain the virus for the betterment of our people. Tonight, I would end by continually expressing our gratitude to the government and people of the United States for the generosity exhibited to our country. That's a mark of friendship, and we believe that we will continue to receive this support, not only in terms of vaccines, but even in terms of even building capacity for our health institutions, so that at least if there are going to be any pandemic in the future, we'll be better prepared to deal with it. I want to thank you for this evening, and I'll continue to urge Nigerians that this is not the time to listen to conspiracy theories. I saw some clips of people putting spoons on their arms and saying that because of the vaccines, their bodies have become magnetic to metals. That's utter nonsense. And we should not promote it. It just creates a situation of confusion in the minds of our people, something that is supposed to help them, provide some extra backing of immunity and security for their lives. We just play around with it and cause them to develop some elements of hesitancy towards taking the vaccines. And like I said in my opening remarks, that unless we get done with this, COVID-19 might be here for another decade if we don't deal with it. So it is better we deal with it most appropriately now, so that we can begin to return to something that looks normal, or else these coverings will be here with us as a people. So the choice is ours. In everything in life, you must assess the risk and take an informed decision to protect yourself, to protect your loved ones, to protect those that are around you. And that is what we will continue to do on the part of the Presidential Steering Committee, to give the guidance and the leadership that is required to deal with this virus. So far, we've tried, and I want to commend Nigerians for their support, but we need to do more as we approach the future. Thank you, and have a good evening.